The overall impact of implementing Radar Healthcare has been an improvement in quality of life.
The introduction of Radar Healthcare system has improved our health and safety culture. We recognise that we are looking after some of the most vulnerable people.
This system has helped us revolutionise how we, as an organisation, can share learnings in a really timely manner.
So our mission at Exemplar Health Care is to make every day better for adults living with complex needs, whatever that looks like to them, maybe following a brain injury or spinal injury, physical disabilities, mental health conditions, whereas others will come to us with illnesses and conditions that are progressive, and we will support them through their end of life. We currently have 50 complex care services across England, and we have plans to increase that as demand for our services grows across the country.
Exemplar Health Care 6 years ago was fully paper-based. We had a very complicated incident management system, which led most of our teams to have to fill in at least 7 pieces of paper when they actually reported an incident. And I have waited to actually introduce a system that would make everybody's lives simpler, but more importantly, reduce risk of harm. And Radar Health Care has definitely supported us to do that.
The biggest benefit for us was the speed with which we have that information. I could always have collated all the paper records and gone through them all, but it'd have taken me weeks, whereas now I can do it as soon as they're happening. And it takes me very little time. It's about 3 clicks of a button for me to pull all the incidents for a particular service user, for example.
Prior to the implementation of Radar Health Care, we could only really track and report on data every 4 weeks. That could be incidents with process, or it could be a medication error. We now can see them as they happen, then actually take real-time action to ensure that that risk of harm to that person is reduced. So Radar Health Care has impacted so positively on our everyday operations, both for central staff, but certainly on the front line.
Since implementing Radar Health Care, we're able to provide support to the services much faster than we could before. We have lots of residents that display behaviours of concern or have other risk factors. If we can reduce those events, then obviously people are able to enjoy a much better quality of life. Being able to export the radar information into a system in which we can snapshot the data at any point helps us to analyse data across the whole company, by region or service by service. One of the things we have noted is an overall trend in a reduction through injuries related to physical aggression. We've also seen a 50% reduction in incidents of physical restraint year on year, which has been a fantastic achievement.
By implementing Radar Healthcare, we hope to achieve digitalisation of all our health and safety processes, all our health and safety audits. I feel those objectives have been met and actually have been exceeded. The annual health and safety audit is now in 6 sections. We had a project manager who helped us implement that process, which made it a lot easier. Together, we looked at the question sets, we looked at whether they would work in a digital format. We gave everyone in the work group access to the staging platform where we could test the system before we went out live with the system itself. We did have a digital platform previously to Radar, and feedback from that wasn't so good. So moving to Radar has actually been a really positive change in our health and safety culture, because the first line user has found it much easier to use than the previous platform.
When you talk to the staff teams on the front line, Radar Health Care has actually improved the way that they report incidents and complaints in a very timely manner. The rollout of the system within our organisation has been streamlined with no incidents at all. The investment into this system has been totally justified.
We're getting much better data, the quality of it, and we're also getting much more of it, and it's easier to collate. From using those things, we can develop much more accurate behaviour support strategies that are much more likely to be effective first time around.
To get that standardisation and consistency across the company, it's really important that our colleagues can always access the most up-to-date and current documentation to make sure that it aligns with the most recent legislation, compliance regulations, law. So we use Radar Health Care already for many parts of the business, and we came across the document management module within it, and that actually meets everything that we were looking for in a document management system. If we've updated a really important policy that we want to make sure that everyone's read, we're able to do that within the document management module within Radar Health Care. So it almost gives us that one centralised place within a system that we're already using.
prior to Radar Healthcare being introduced, complaints and compliments were really managed at home level. To be able to now report on compliments as an organisation and actually discuss those at our executive meetings, at board meetings, that's brought some really positive affirmation of actually what the homes do on a daily basis, which is amazing.
I would really recommend to any healthcare organisation out there that Radar Healthcare is the platform for a healthcare organisation.
It's been a real improvement across the board in terms of the systems that we're using. Radar Healthcare allows Exemplar Healthcare to have that safe environment through which we can build really positive, supportive environments for people to live in.